Hi, everybody. Welcome back to the National Autism Association's webinar. We are so grateful tonight to have Dr. Nancy O'Hara and Gabriella True here to discuss PANS and PANDAS. It is a topic that is affecting more and more families, and there are no two better people here to help support families than we have with us tonight. So I will give a brief intro. If you would like to join and jump in on the chat and let us know where you're joining from, you can also type into the chat or Q&A any questions for Dr. O'Hara or Gabriella, and we'll get going. So Dr. Nancy O'Hara is a board-certified pediatrician. Prior to her medical career, she taught children with autism. She graduated with the highest honors from Bryn Mawr College and from the University of Pennsylvania School of Medicine. She earned a master's degree in public health from the University of Pittsburgh, and she is a leader in the training of clinicians both in the U.S. and abroad on integrative and holistic care of children with chronic illnesses and neurodevelopmental and neuropsychiatric disorders such as PANS, PANDAS, tick-borne diseases, mold and mycotoxin illness, and all post-infectious syndromes. Dr. O'Hara has written a comprehensive guidebook, Demystifying PANS and PANDAS, a functional medicine desktop reference on basal ganglia encephalitis, which is available on Amazon in ebook or softcover formats. For more information on all of this, as well as her membership and mentoring programs, please visit www.drOhara.com. That's OHARA.com. And we also have with us, because this is such a cumbersome diagnosis for families, my family has been through it, it is very overwhelming. So we have with us tonight joining Gabriella True, who will give a brief overview after Dr. O'Hara's presentation on her organization. Gabriella True is the president and a founding board member of ASPIRE, which stands for Alliance to Solve PANS and Immune-Related Encephalopathies, a national nonprofit focused on awareness, education, and support for individuals and families affected by PANS and PANDAS. Under her leadership, ASPIRE delivers programs and resources for patients, families, schools, healthcare providers, and policymakers while advancing education, advocacy, and policy change. As a mother of two young adults with PANS and an adult patient herself, Gabriella brings both lived experience and professional leadership to her national advocacy work. So thank you both so much for joining us tonight. Dr. O'Hara, if you would like to share your slides.
Absolutely.
Yeah.
I just want to thank NAA and ASPIRE, two of my favorite organizations, for inviting me. And, this is such an important topic that I'm always happy to talk about it. So put your questions in the chat. I'll do those after Gabriella's talk, and we'll go from there. So, PANS PANDAS does exist. This is one of my favorite quotes from my mentor. It is, what I live by. Follow those who seek the truth, but flee from those who have found it. What that means to me is if anybody tells you PANS PANDAS doesn't exist, autism is only genetic, you're crazy, run the other way. We are all looking for all the answers, and none of us have all the answers. Definitely not me. This is from the 2012 white paper that Susuito and 30 other clinicians got together. The prototype for PANDAS is Sydenham's chorea. That was a neuropsychiatric movement disorder associated with OCD after rheumatic fever. Then in the 1990s, Sue coined the phrase PANDAS, pediatric autoimmune neuropsychiatric disorders associated with strep. And, Sue and I talked a couple of months ago and again just last week. And, she wishes she still called it autoimmune encephalitis of the basal ganglia associated with streptococcal infections, because that's easier to say. And I wish she had called it the Suito disease, but this was way too controversial. So in 2012, they included other microbes that caused these abrupt onset of neuropsychiatric symptoms, including Lyme, mycoplasma, viruses, and environmental factors. I include mold and yeast, anesthesia, and everything else under the sun. The thing about the abrupt onset to be this moniker, it really should be of abrupt onset. But with mold, with vector-borne diseases, which are seen in so many kids, it can be much more subacute. And if your initial presentation, like a child I'm lecturing on at the upcoming MAPS, Medical Academy of Pediatric Special Needs Conference in September, a 9-year-old came in with autism that was diagnosed at age 3, but it was actually COVID and measles that caused it. And even at age 9, we were able to reverse all of her symptoms. So the abrupt onset was way back when she was 3, but she kept having more subacute things. And again, as Gabriella can attest, this can happen in adults, especially with vector-borne diseases and mold, or if it was unrecognized, untreated, mistreated, misdiagnosed as a child. So although these monikers should be used for pediatrics and for abrupt onset, it really includes all of those other people too. And definitely includes kids with COVID, the tick-borne diseases. I mean, at least 40% of our kids have Bartonella and Babesia. And I was just thinking about the numbers this weekend, and I think it's closer to 60%. And we're not talking about a rare disease. We've always said 1 in 100. In my practice, it's 1 in 1. It's really more like at least 1 in 150. And so many of our kids have a chronic illness. But this is an autoimmune disease. It is not an infectious disease. And yes, genetics loads the gun, environment pulls the trigger. So there's a genetic predisposition, and then what triggers it? Multiple different things, as I was saying, including dietary and environmental factors. And they affect the gut, because the gut's not the second brain, it's the first brain, and the microbiome and the interaction between all of those in the immune system to lead to the clinical outcome of either health or disease. So again, to be PANS, but it can be, we could use post-infectious syndromes, and it can be much more subacute or chronic. But with PANS, it should be an abrupt, dramatic onset or recurrence of OCD, maybe including a restrictive OCD like eating disorder where they're worried about contamination or vomiting or only eating certain foods. That classically has been 20%. It's now more than 35, 36%. And then 2 of the following, separation anxiety, emotional lability, that's 0 to 60, the developmental regression, the handwriting deterioration and tics, the deterioration in school performance. And if you have any one of those, plus OCD, plus urinary symptoms like abrupt onset of enuresis or urinary urgency or frequency, or REM disinhibition where they have really restless sleep, that's pathognomonic for this disease, as is just the handwriting deterioration and a couple things I'll show you in a minute on physical exam. Again, in a child with autism, they may have OCD, anxiety, regressions that are much longer lasting, but it's a new change. It's a dramatic recurrence or a dramatic change in that OCD or any of the other symptoms that we're looking for. I learn in pictures, so I love looking at things this way. 98% of these kids have a behavioral regression. 90% have handwriting deterioration. 70% have tics. The kids that get admitted to hospitals are the ones that have hallucinations, visual or auditory. 80% have sleep disorders. 80% have that deer in the headlights look. 90% have urinary symptoms. And a lot of these kids will have history of persistent sinus infections, upper respiratory infections, and that's part of the breakdown of the blood-brain barrier. There's a lot of family history or individual history of other autoimmune diseases. And as I always say, you guys are the weaker gender, so there's always more boys than girls, but, we'll go past that. All of these can be causes or triggers. Can be strep, and then it's PANDAS. Doesn't have to be in the throat. 20% of the kids in our practice have rectal strep. It can be in the sinuses. It can be from psoriatic eczema. It can be mycoplasma. And the big thing with mycoplasma is the kids don't have to be sick with pneumonia or bronchitis. They can just have an abrupt onset of behavioral symptoms when grandpa's in the hospital with mycoplasma pneumonia. It can be COVID. It can be many other viruses. And these are the ones I see most commonly, but it can be Coxsackie and Parvo and many others. Testing for all of those may not be helpful. But the history of worsening of behavior after a virus is classic. We call it Lyme disease, but Lyme is really only Borrelia and Borrelia burgdorferi. We should really be specific about what we're talking about. And the ones that are most commonly triggering for our kids neuropsychiatrically are Bartonella and Babesia. And then yeast and mold, certainly, as I mentioned, metabolic changes. So what I'm looking for is a history of autoimmune disease, allergies, atopy, thyroiditis, inflammatory bowel disease, diabetes, and then a preceding history of something that changed. It could be an infection or a viral illness. It could be mold, water damage. It could be a tick bite. And then a positive response to immunotherapy. And I'll talk about that a little bit more. But this is literally the handwriting deterioration that I see from one day to the next. That's the same child. And COVID has changed the game. Not just the injection, but COVID itself has reactivated a lot of chronic viruses. It has reactivated tick-borne disease. It has reactivated yeast and mold. And so everything has gotten worse, in my opinion, in the last 5 years. Not just because I've been so much busier, but because COVID has reactivated all of these and caused some of it. When it's Borrelia, certainly you can have the typical flu-like symptoms, the neck pain, the joint pains, the nerve pains, the headaches, any of these. But in kids, the biggest things are brain fog, slow processing, cognitive impairments, anxiety, depression, headaches. So if you've got any of that, you should be looking for Borrelia. With Bartonella, we also see the muscle, joint pains, and headaches, but we see exceedingly slow processing speed. We see migratory fasciculations and tics, neuropathy, where they have the pins and needles feeling in their fingers and toes, and rage, especially when a kid has rage that just is that uncontrollable aggression, destroying the house, destroying themselves, or that constant daily flare without the episodic up and downness that we see with so much of PANS and PANDAS. When you see that daily flare or that rage, think Bartonella. But it can also be anxiety, depression, OCD, foot and heel pain, bunching up their socks, and then the stria like this, the blanching, like when you press on them, the color changes. They're either horizontal or vertical. They don't follow dermal lines, and they can be anywhere, classically on the back, but I've seen them on the knee. I've seen them on the forehead. I've seen them on the back of the neck. And if you've got that, that's classic for Bartonella. And then Babesia, which is now the most common in our area of the country, which is Connecticut, New York, New Jersey, the New England area. Babesia of all sorts, but particularly Babesia odocoli, which goes straight to chronic symptoms, have really increased over the last few years. So the symptoms I see with Babesia are that pressure headache, the dysautonomia and paresthesias, the night sweats, the rib and bone pain, the air hunger, like feeling they can't get their breath, the anxiety, the brain fog. But some kids just have GI symptoms. That's all they have. So you've got to think about it and consider it. And I'll talk about ways we can test for it, both expensively, less expensively, and inexpensively, like no expense. And we'll talk about that in a bit or in the chat. So I also think about, have they been exposed to mold? And a lot of you are there saying, well, everybody is. Everybody has mold. Well, yes, but 25 out of 100 people in a moldy house will be susceptible, and 2 will get really sick. So you need to know if the child is susceptible to mold, and if they are, and they have mycotoxins in their urine or antibodies in their blood to mold, it needs to be treated. We also look at other exposures. We look at mineral levels, particularly magnesium, zinc, sometimes selenium. We look at antioxidants like vitamin A and vitamin D. We look at their mitochondria. We look at thyroid antibodies because they're often elevated. Even though the thyroid may be normal, they're often elevated. Dr. Lindsay Wells and I did a study 2 years ago on folate receptor antibodies in children with PANS PANDAS, because as many of you know, and as Kennedy has recently said in September, that many of our children with autism, as Dr. Fry and Rossignol has shown, well over 70% with autism may have cerebral folate deficiency. What Dr. Wells and I showed is that 63% of kids with PANS and PANDAS also have cerebral folate deficiency. And Dr. Wells and Dr. Hinchy just published a study in tick-borne diseases showing that about 60% of those also have cerebral folate deficiency. I also think it's important to do COVID antibodies. That's a SARS spike protein antibody, because that level should be less than 1. And if you're immune because you've had it before, it should be, maybe in the low 100s. But I've got kids that are greater than 2,500, 9,000, 10,000. And also, in my opinion, we should all be gluten-free and dairy-free. But certainly if a celiac panel or celiac susceptibility is there, we should think about being gluten-free. And if we have folate receptor antibodies, dairy-free also. And then mold is a big one. Either mold or any form of vector-borne disease can cause chronic inflammatory response syndrome. And that's why these are much more subacute or chronic. You may not see the abrupt onset with these. And it's any biotoxin or mycotoxin that increases inflammation. The biggest symptoms are electric shock sensations, lightning bolt pains, especially down the spine, pulsing and vibrating sensations. But look at all of these. Any of these can be it. Fatigue, memory impairments, headaches, lightheadedness, cramping, hypersensitivity, congestion, chronic GI complaints, body temperature irregularities, all of that. So you really need to think about it and test for it. So what is going on for our kids? Let's think about strep. So there's that genetic susceptibility, that genetics loads the gun, and then there's the trigger. So with strep, let's say they get strep throat. And in our kids, there's a misdirected immune response. Rather than the antibodies, the proteins of the immune system attacking the throat, it attacks the basal ganglia in the brain. It crosses the blood-brain barrier and causes the symptoms that we see, like anxiety, behavioral regression, tics, OCD, etc. This is an excellent webinar by Dritan that talks about why our blood-brain barriers are broken down. And we see that a lot because of the toxic world we live in, as well as the breakdown because of chronic upper respiratory infections. And also there are other genetic and immune system reasons like strep-specific Th17, et cetera, that cause this. But basically, it's a misdirected immune response. So the throat may be pristine. So anytime a child has any of these symptoms, get a strep throat culture, not a quick strep, a culture. May mean you need to go to urgent care or whatever if your pediatrician won't do it, and see if the culture is positive, even if the throat looks pristine, especially if other kids in the family or in the classroom have strep throat. The child may only have behavioral changes. And then we look at the physical exam. The choreoform movements are a big one. That's where you stand with your feet together, your arms outstretched, your fingers outstretched, and your eyes closed, and you see if you can keep your fingers steady. If you start playing the piano with your fingers, like moving your fingers or rotating your hands, that's a choreophore movement. That means the basal ganglia is inflamed. And that's classic pathognomonic for this disease. Now, again, a lot of our kids with autism can't, or if they're in a flare, can't do that. They like can't stand still, won't shut their eyes. But there are ways we can help to see that. There are other little techniques that on exam we can do. There may be a red anal ring. There may be peeling fingers, like that glue peel. That's only in about 10%, and the red anal ring is only in about 20%. There may be strawberry papillae. That's what we see there, that strawberry tongue, the raised papillae. This tongue is also kind of yeasty with that thrushy kind of look. There may be palatal petechiae, like a classic strep throat, but again, like I said, the throat may look normal, still do the culture with strep. And then there may be a damaged vascular bed, like we used to see with rheumatic fever and the Jones criteria. That's very rare. That's in about 1%. Other physical exam clues, you could see a bull's eye rash. At most, 20% of kids have this, but it may not look typical. If it's in a hairy area, it may look more like that. If it's behind the knee, it may look more like a bruise. And this is a kid, I show this picture all the time. This mom called me and said, my pediatrician is calling Department of Children and Families on me because they think my child was abused. I said, that's not abuse. That's Borrelia. That's Lyme disease. And the next day it looked like that with a much more classic red ring and the clearing in the middle. And then again, the striae that blanch like we see here with Bartonella. You may see swollen tender glands. You may see tender sinuses. There may be the whiteness on the tongue when there's mold or yeast, or a positive Woods lamp on exam, which is another way to look for yeast systemically. So how do we prove it? It is history and physical exam. There is no lab test that proves or disproves PANS or PANDAS. All of the lab tests may be perfectly normal. And if you have a child with these symptoms, you should still think about it. So we do culture the sites, strep cultures, viral cultures, mycoplasma cultures. If a child is getting a TNA, a tonsil and adenoidectomy, make sure they culture the tonsils and adenoids, because what's on the surface may be very different than what's inside. So that's really important. And also there may be more inflammation than what you see with kids that are having a TNA from obstructive sleep apnea, for example. Do not treat titers. A child that has high strep titers and they're saying, well, this is PANDAS. No, they may just have had a strep infection. It may be another cause. If they have mold and you put them on antibiotics, they may get worse. If they have tick-borne disease and you only put them on one antibiotic, they may get worse. So really what's most commonly positive are the inflammatory markers like thyroid antibodies, C-reactive protein, sed rate, and especially ANA. The strep markers may be normal because 40% of children with documented group A strep do not show a rise in titers. 40%. And if you do it too soon, they also may not be elevated. So as Sue says, she wishes this test, the ASO and the anti-DNase-B, were never developed because it's a false sense that this could be strep and we may be missing a lot of other things. So we really should do mycoplasma, IgG and IgM, regular lab, test for Borrelia, the Quest Borrelia, immunoblot, not Western blot, not two-tiered ELISA, but the immunoblot from Quest, not other labs, but from Quest, is as accurate as any of our specialty tests. MDL is also often covered by insurance and very good for Bartonella and Borrelia. Babesia is a little bit harder. You can check Brucella, And that is often cross-reactive with Bartonella from a conventional lab. But the Babesia, in 40 years of doing this, I've probably seen 2 or 3 that were positive. And that's where you need the specialty labs. And in the question and answers, I'll be glad to tell you more of the specialty labs that I use. But one of the things that you can use that cost you no money is the questionnaires. Dr. Horowitz developed a very good questionnaire for vector-borne diseases. And if your child has a positive result from filling out that questionnaire, then you should be treating for vector-borne diseases. Jill Christa developed a wonderful questionnaire for mold. And if that's positive, you should be treating for mold mycotoxin disease. So questionnaires, do it. And the same with PANS PANDAS. Tanya Murphy and Sue Sweeto developed a wonderful questionnaire for that. If that's positive, we should be treating for it. The Cunningham panel people talk about a lot. It is very accurate, but it's also very, very expensive. I use it if there's not a classic clinical picture. And I can tell you in the last 5 years, I've probably done it once, unless a parent was really pushing me to do it. But it is very accurate in children with Sydenham's career or PANDAS. The CAM kinase is very elevated. That's a calcium modulating protein that indicates that there's basal ganglia inflammation. And with kids with OCD, tics, ADHD, neurotypical kids, it's often much lower. There is some overlap when you're in the 130 range, 140, but if it's over 150, that definitely means you're dealing with PANDAS. I do think, again, it is a clinical diagnosis. So if you have OCD or restrictive food intake and 2 of those, any of those, you should be thinking about this disease. You don't need blood tests to prove it. Now, how do we treat it? Well, we have to treat it. We have to treat the symptoms. I think a lot of times in functional medicine, we just treat the underlying trigger in the immune system and we forget about treating the symptoms, which we can do very well with nutraceuticals and herbs. In conventional medicine, we often just treat the symptoms and we want to put the kids on SSRIs or antipsychotic medications, which can suppress it and can be a really good Band-Aid and sometimes may be necessary, but it is just that, a Band-Aid. We have to treat the underlying source of inflammation, and I really like herbals. Yes, we do have to use antibiotics sometimes, but especially if there's more than one trigger or vector-borne diseases, herbs can work very well. And then also treating the immune system. So let's look at the symptoms we're treating and how we do. This is a sort of graph, again, I learn in pictures of treatment options for OCD. So you can have medications like SSRIs, SNRIs, anxiolytics, antipsychotics. I sort of go past those usually. I'm a big believer in therapy. Space therapy is great, especially if a child can't do CBT, DBT, or emotion event response prevention. Space is supportive parenting around anxious childhood emotions. And it's really about helping a family learn how to deal with these and helping the child get past it, because we want to empower the child as much as possible and not coddle, in my opinion. Lifestyle breathing. Everybody can take deep breaths, even our kids with autism. Exercise, getting our kids moving, sleeping well, and good diet. It's an anti-inflammatory diet that's as full of proteins, vegetables, oils, and some fruits as possible. The less processed foods as possible. I know it's hard. And if it's too stressful, I'm not pushing it, because the biggest culprit in all of this is stress. And the adaptogens are great for stress, things like rhodiola, ashwagandha, 5-HTP, vitamins, minerals, amino acids like magnesium, inositol, GABA, and theanine. And then N-acetylcysteine has 17 studies behind it in treating OCD. Hemp is very good for anxiety, and lithium orotate. Dr. Jim Greenblatt who I do a lot of these lectures with in Psychiatry Redefined, uses low doses of the supplement lithium orotate with very good success in treating OCD. So N-acetylcysteine, as I said, has multiple studies. It's a wonderful treatment for OCD in many different forms. Couple things to keep in mind. One, it oxidizes when exposed to air. So if you put NAC, if you open the bottle once and put each daily dose in a little Ziploc or blister pack, that can help decrease that oxidization. The other thing is all the studies were done in 2,400 to 2,800 milligrams per day. So when people say they're using NAC, but they're only using one capsule, that's not enough. You really need to get to higher doses. And keep in mind, NAC is great for increasing glutathione, but some of our kids with gut dysbiosis, yeast, and mold may not do well with NAC. So if your child has a bad reaction to NAC, move on. Think about other things. Think about inositol. Inositol is great, but again, you have to get to 18 grams per day. There is a powder. Vital Nutrients has one. Pure Encapsulations has one. And it's a very sweet flavor that can be very helpful in decreasing OCD and anxiety. Ashwagandha, we call the herbal Valium, and it's been comparable in mice models to Prozac. So that can be very helpful. And I put a lot of studies in here because there's research behind this. This isn't just me telling you. This is real research that shows that these things work. And then the lithium orotate, as I just said. There's also multiple things for anxiety. There are other medications that, like blood pressure medications, amantadine, which is an antiviral and anti-inflammatory that can really decrease anxiety, that are much safer than some of our antipsychotics. And there are many supplements like 5-HTP, if you're not on SSRIs, that increases serotonin. Magnesium, particularly magnesium glycinate or threonate, help decrease anxiety and particularly tics. B6 can helpful. GABA, lemon balm, saffron, and then folinic acid, especially if they have cerebral folate deficiency. And this is the article that we wrote together with Dr. Fry. Methylfolate may be helpful, but if you have cerebral folate deficiency, you often need high-dose folinic acid or leucovorin. All the things that I talked about that treat anxiety and OCD will also help tics, but the biggest one is magnesium. Glycinate and threonate for tics, for sleep, for brain fog, citrate and oxide for constipation, and good old Epsom salt baths are great. I was talking to Dr. Casey Kelly yesterday for my podcast, and she puts 2 cups of Epsom salt in every bath. I've only been putting 1 cup, so maybe I need to increase that. But that's a great source of magnesium, a great way to detox. Adding some baking soda to it also decreases acidity, and adding a little bit of essential oils like thyme or thieves or lavender may be very helpful. Antihypertensives may be helpful for pharmaceuticals. I really don't use neuroleptics, but they have been proven to be helpful. Second generation anti-seizure medications. This one's really good. This one's $10,000 a month. But I wanted to at least list them here. I use a lot of therapy, diet, exercise, mindfulness, physical medicine, acupuncture, counter tics, like if a child has vocal tics, chewing gum or humming. If they have motor tics, playing with a widget or something in their pocket can be really helpful. Sleep disturbances have to be treated. When in your sleep, your immune system regenerates, your detoxification system detoxifies, so everybody needs to sleep. I'm a believer in melatonin if it works, 5-HTP, magnesium, GABA and theanine, valerian, all of those together or one or the other can be very helpful in helping kids to get to sleep. Food restrictions, very common. You often have white spots on the nails when there's when there's zinc deficiency. And zinc is really important for our kids with food restrictions, as is protein and oils in the diet. And bitters like ginger may be very helpful rather than something like a PPI, Pepsid, etc. Emerson didn't mean the gut when he said what lies behind us and before us are small matters compared to what lies within us, but I do. I think the gut is very important, and we have to heal the gut or the rest of us is not going to heal. And this is my little boy years ago. He's now 27. You can see he had a little bit of a bloated belly here. We still had work to do, and we were successful. With PANS PANDAS, you can use antibiotics. I am bicillin if a child has gut dysbiosis, may be very helpful, but it's very painful. All of these antibiotics may be helpful. I first usually use azithromycin because it gets strep in our area, mycoplasma, and it's a first line for Babesia and Bartonella, as well as a second line for Borrelia. So I may start with that because the other thing is it has immune modulatory properties. It helps to decrease inflammation. There is regional resistance, and that is getting greater. My second choice is usually Ceftonir because there's good evidence for that, but it doesn't treat mycoplasma. And the other antibiotics may really increase gut dysbiosis, especially amoxicillin clavulanate or Augmentin. One of the biggest mistakes we make is we give a child an antibiotic and then we stop it and we don't do anything else to prevent them from getting further strep or further tick-borne disease or whatever. So that's why I really like herbs. Herb for strep include Usnea, Tega, which is great. It's a pine needle extract, berberine, especially in golden seal, oil of oregano, neem, and there are many others, but those are some of my favorites that I use. And I will use one rotating every week to 2 weeks with another, and sometimes up to 3. Antimicrobials for mycoplasma, I usually do use azithromycin first, but there are several good herbs, including, again, golden seal, hatunia, isatis, cryptolepis, silver, which is also very good for strep. And I often alternate herbs because mycoplasma can also be a tick-borne disease. And you don't usually see severe mycoplasma like this. Again, you usually don't see symptoms. So I will often use herbs for mycoplasma long term. You know, as we know, for the common cold, there aren't great antivirals, but vitamin A is a wonderful antiviral. I do recommend testing for that. If a child has a low vitamin A level, using a high dose vitamin A may be very helpful. You want to do that together with a practitioner because it is important. Vitamin A and vitamin D are fat-soluble vitamins. So if you use too much, they can be toxic. So you want to follow those levels. Others like vitamin C, lysine, monolaurin, and a form I really like, aqualaurin, which has a biofilm buster with it, can be very helpful. And you're just going to pee those out, so you don't have to worry about dosing. Olive leaf extract, lemon balm are also great antivirals. And anytime a child has a flare, I implement an acute viral protocol, which is increasing or doubling the dose that they may be on of vitamin A, vitamin D, zinc, and lysine for a week to 2 weeks, or at least until symptoms resolve. There are multiple antibiotics for tick-borne diseases, and you often have to use more than one. And how long? It's not a day, it's not weeks, it's often months, and usually 2 months symptom-free. And for some of these tick-borne diseases, that may be 9 months or longer. And it may require multiple courses. and biofilm busters. And that's why I use a lot of herbals. There are multiple studies that show that herbals like Cryptolepis, Artemisia, Chinese skullcap, Japanese knotweed, Alcornia, for Babesia, for Borrelia, for Bartonella, have better inhibitory activity than even antibiotics. So I use Artemisia, I use grapefruit seed extract, I use stevia, I use cat's claw, Japanese knotweed, berberine, all of these, Cryptolepis certainly, for our kids with vector-borne diseases. And stevia is one I almost always add because it helps the flavor. And it's not, Truvia or industrial, it's a real herb, stevia leaf extract, that makes it taste better and also is not only its own antimicrobial, but it's also a biofilm buster, especially in the form by a company called Nutrimetics. Often what I'll do with Borrelia is I'll use cat's claw, stevia, and atoba bark and switch that up with Campsiandra. If they're not getting better, I may switch to Japanese knotweed, Cryptolepis, or others. When it's Bartonella, I'm usually using Japanese knotweed together with Hatunia, Campsiandra, and stevia. If that's not working, I may switch out the Hatunia and add Cryptolepis. And then with Babesia, I'm always using Cryptolepis, cat's claw, and pulsing Artemisia. So there are lots of ways to do that. I'm not going into all the details of these because we really don't have time. Happy to give another one just on tick-borne disease, but those are the herbs that I really use. The immune modulators are really important. Just last week, I gave a whole lecture just on immune modulators. I love probiotics, prebiotics, and symbiotics. However, some of our kids are very sensitive to it, and they may not be able to take that. So essential fatty acids, I love. What's the biggest problem with essential fatty acids? We underdose them. Kids need 3 to 6 grams and sometimes more. One pill maybe has 1 gram, and 1 teaspoon may have even less than that. If a child gets worse with essential fatty acids, that may be a sign of mast cell activation, and I'm really looking for tick-borne disease and mold in those kids. Aloe is one of my favorites. Designs for Health has a great aloe. That aloe is a great anti-inflammatory, antioxidant, and it also is a bile binder of mold mycotoxins. A lot of times we're using charcoal binders with mold, and all that does is increase constipation. So I use a lot of aloe. I also use a lot of curcumin. My favorite is turmeric, like Avea from Nutrimetics. It is very safe in typical dosages, and in the short term, you can use a higher dose to decrease anxiety, and I will use that quite frequently. Another one in pill form is specialized pro-resolving mediators, or SPMs. This is a phospholipid that helps to decrease the reactivity to immune and other challenges. I love ECG, EGCG, medicinal mushrooms. I use a lot of cordyceps, Chinese skullcap in my kids with PANS and PANDAS. Those can be very effective. And then ibuprofen. If you're not sure if your child has inflammation, give 10 milligrams per kilogram of ibuprofen and see if the severity, intensity, or frequency of the flare decreases. If it does, then this is based in pain or inflammation, and we really need to think of other anti-inflammatories. LDN in very low doses, 0.25 to 1 milligrams may be helpful. And then I use a lot of mast cell mediators, antihistamines. Ketotifen is one that's very good. Cyproheptadine if they have an eating disorder. And bioflavonoids. Neuroprotect is a great one. Quercetin in high purity is great. I don't use montelukast, which is singular anymore, because it can cause psychosis. But my favorite prescription form of mast cell mediators is gastrochrome or cromolyn sodium. And that can be very effective in decreasing anxiety, as well as helping gut inflammation, as well as brain inflammation. Steroids I very rarely use. Probably at this point in my life, I can count on two hands the number of times I'm using it. There can be worsening with certain genomic defects, SNPs, little pieces of genes that are abnormal, or with mold and yeast. But it's only a temporary fix. If they get better with steroids, that usually means they will also get better with IVIG. One of the biggest problems with IVIG these days is insurance isn't covering it. And if they are, they're only covering it in immunodeficiency dosing. And for kids with autoimmune disease like this, they need 1.5 to 2 grams per kilo. So that is important and often what's needed. We used to say one and done. That's not the case at all. They need at least 6 cycles, which are usually 4 to 6 weeks apart. IVIG can be very powerful, but it is hugely expensive. Plasmapheresis, I've done a much deeper dive into this recently, and we're using more and more plasma exchange in our kids with autoimmune diseases and adults. And I think it is a very safe intervention. Again, it may not be covered by insurance. We got to try to work on that more. But they're removing the child's own blood, cleaning it, spinning it, removing the antibodies, replacing that with albumin, and returning it to the child. Those two aren't easy. And neither is rituximab, which is saved. That's a monoclonal antibody saved for very severe cases. So in a lot of kids, I can get them better sooner. With things like IV platelets in precision dosing, Hellman therapy, and all the oral things that I talked about. I've talked about all of these alkalinization, like with baking soda. Xylitol is a great antimicrobial nasal spray if you think you're dealing with mold or have excuse me. There may be 2 more sneezes coming, so I apologize. It's great for mouth caries. It's a great antimicrobial that has a very sweet flavor that a lot of kids can tolerate. Probiotics in an oral form like Bliss K12, ENT Biotic can be very helpful in decreasing the seeding of the gut with germs from the mouth. It's a lot. There's the second one. But you can do this. It doesn't have to be this many supplements and medications. It may be just a few, but the kids can get better. So why is there all the controversy? Well, 79% of pediatricians, when the kid comes in with ear infections, upper respiratory infections, won't even check for strep. And then when they get a flare, a regression, a few weeks later, they don't know they had strep. The timing of the strep infection or exposure can be up to 3 months after. And if a child's used amoxicillin for a lot of infections in the past, and then a pediatrician uses that to treat pandas, it may not work. And then the kitschy name, the small number of prospective studies, but this is a real disease. I cannot emphasize that enough. It's an autoimmune disease with multiple different triggers besides strep. So how do I know? It's a clinical suspicion, handwriting changes, urinary changes, sleep changes after a strep infection or after any infection. There may be handwriting changes and those choreiform movements that I was showing you or talking about before. And then response to ibuprofen or other immunomodulatory interventions. This is not a sprint. We need an initial course that it's at least 3 to 4 weeks long, and then we need to reassess. We may need to change the antimicrobial. We may need to figure out what we've missed. We may have thought it was just mycoplasma, but there's vector-borne diseases or mold. We need to treat the flares with ibuprofen, turmeric, as I talked about, the acute viral protocol, other immune support, doubling up on what helped before, and figuring out what the trigger was and treating accordingly. Teething and dental procedures can also cause flares. And please breathe. You know, putting your own oxygen mask on is really important. Your stress increases your child's stress. So remember to breathe and know that with PANS and PANDAS, this can get better. There are lots of ways that you can do this. I do have a podcast, which is free. I do mentoring for parents as well as professionals. And I do have a membership that's open to parents and professionals. And you can find that on my website, which, as Crystal said at the beginning, is drohara.com. Not trying to sell you anything. I'm just trying to give you options. These are great organizations. NAA and ASPIRE are two of my favorite organizations. MAPS, the Medical Academy of Pediatrics and Special Needs, has also added a parent conference on Sunday in September. So there are lots of resources out there that you can use. So it's a clinical diagnosis that may be confirmed or not by lab evidence. You need a complete medical, psychiatric history, physical exam, cultures, blood test, as I talked about, immune markers especially, sometimes an organic acid, the metabolic antioxidant markers, as I talked about. The other tests, you know, maybe, but I don't usually do them. I use my treatment in my N of 1 in the child in front of me as a guide as to whether this disease and what the triggers for this disease may be. All of these are faces of PANS and PANDAS. The child with a restrictive eating disorder, the child that's not sleeping at night, so sleeping during the day, this child with separation anxiety, with abrupt onset of ADHD, with handwriting deterioration, with OCD, with rage. All of that can be part of this diagnosis. So again, it's a clinical diagnosis of abrupt onset, but it may be more subacute, especially with Bartonella, Borrelia, Babesia, mold. Always a three-pronged approach. The earlier you can treat, the better the outcomes. And it is a marathon, not a sprint. Creating fluid access, because there's an episodic nature of this. And don't let anybody blame your child. Find somebody to partner with that listens to you and your child. And I appreciate you being here. I will now, and there are tons of references, lots of them all over the place. Gabriella, let me stop sharing. And Gabriella, if you want to share your part, and then I can do the question and answers in the chat.
So I'm Gabriella, and like the NAA introduced me. I'm the president of ASPIRE. We were longtime patients of Dr. Nancy O'Hara, and now my boys will be turning 22 in July. And as she's going through her lecture, I'm like, did that one, did that one, did that one, did that one, check, check, check. We definitely did. It took a long time. She's right. It is a marathon and not a sprint. And there were times where you really wanted to put your head into the wall for a while, or just crawl into a ball and cry, which I'm really, really good at crying. So, but throughout that process, working with PANS families, I started in the autism world, and I know how important it is to build community and provide easy to understand resources. So that's really what we do at ASPIRE. or at least we tried to do. Our mission is really broad, which is to improve the lives of children and adults affected by PANS, PANDAS, and related encephalopathies, and working with, 5 core audiences of the general public: families and patients, schools and educators, providers and research, and of course, public policy makers. But, most of our programs are designed to be understood by the common layperson, because it can be really confusing. And we know a lot of you will stay up all night long reading research papers and going, what the heck is this? And so we try to make that a little bit easier for everybody. But, our main thing is doing a lot of one-on-one email support. We have a wonderful Facebook group. It's pretty small. It's not as daunting as some of the really big ones. We do a lot of chit-chat meetings, which is what we call our peer-to-peer support meetings. Most of them are done virtually. We have them regionally and in a few states that have them specifically. And then we also do them by topic. So we have restricted eating ones. We have one just for adult patients. And then because of that, we have one for parents of adult patients, because the conversation becomes different when we're having a kiddo that still at 30 and affected or something like that. And then homeschooling, there's others. And then we have a huge resource library. Our website's a lot. I realize that. But if you go over to the side to resources, there's lots of different tabs in there with toolkits that are easy, one-pagers to hand your mom or a mother-in-law who does not understand. I can't, you can only lead a horse to water. I cannot make them drink. But usually our handouts are pretty understandable for everybody. We have bigger ones and small ones, depends on their learning capacity or capacity to pay attention. So, and then we have a lot of webinars. We're going to be doing a new series of webinars starting soon. Don't have an exact date on that, of course, but we are there for you. We answer emails all the time. We have a provider list. Our provider list is a little different than any of the others because it's parent and patient recommended. So, we have to hear pretty good things. There's, barring very few doctors, there's usually not a one-stop shop, and there's always problems with, something that you may not get along. And you don't always get along with every doctor, and that's okay. But sometimes we help you guide to have conversations that make it easier to work with a different provider. Anyway, we also do tons of education because, really, it's part of the whole package of supporting families. So we want to be able to give not just the parent circle information and tools. We want to provide education to your whole family circle as best we can. Maybe if we're not doing grand rounds at a hospital in your area, we can refer you to say Dr. O'Hara's or plan of helping different providers, or referring you to a MAPS conference for the providers. But, and we've done a lot of grand rounds this year. We did like 2 in Nebraska recently, because we just had lots of things going on there and it came organically. But we do school lectures. Of course, now that we're on summer break, that's a little bit, I thought it was going to be a break, but actually I'm getting teachers emailing me. I got 6 this week, so I guess teachers on their own want to learn. So that's why we developed our asynchronous learning program. They just have to email us directly from their school account to be able to access it, and then it's available to them free. But we do a lot of different programs for different people. And one of the other things we help families work with state legislators on legislation. We have a pretty robust section of our website on that, and we're building out a new beginning toolkit for state leads, which is pretty exciting because when we have the initial meeting, when I meet with every state lead, and that meeting's very exhausting for that family member. And it's really the type of thing that you do not need to have any knowledge about working with legislators. And I know it sounds daunting at first, but they listen to people like us as families for different disorders all day long. That is what they're there for. And when you find a real champion, which sometimes takes a little digging, it can be really rewarding and pay off. We did just get passed in Connecticut this year, Nebraska this year, and Louisiana last year. So that doesn't always mean that everything's great, and it doesn't necessarily mean there's going to be new doctors or your local hospital is going to treat or anything like that. But it does open pathways, hopefully. But we really do believe that advocacy is more than just passing bills, but it's just one way that we support you as your entire family. And then we just continue to find more ways and new programs. I look forward to the fall when hopefully we'll have a couple new programs out that I get to share with everybody. But we're really just here to support you and create a nice, safe environment for you, like in the Facebook group or the chit chats. We had a meeting today and the conversation really was about what do you do when all your friends leave? And they start saying, oh, I don't want to be friends with you anymore because your life is way too complicated for me. And it's building your group of friends, your new group of friends. Dr. O'Hara certainly knows that I have developed a great group of friends through autism and PANS and support groups, similar to what we do at Chit Chats. And we're still in group texts all the time. And it's really helpful just for your whole well-being to be able to text someone and go, oh my God, he was raging until 3 a.m. And the other person going, oh, that sucks. And just saying, but you can get through it. It's going to be okay. And maybe not today, but it will be okay. And being able to have someone answer you back that has no judgment. And it's just, that's what we try to create, a soft space for the parents where they can learn and provide information to other people who may be judgmental or doubtful about what's happening with their family. But that's what we do. And so thanks for having us here today. It's been really wonderful. And I always love to listen to a Dr. O'Hara talk. One time she actually said to me, Gabriella, there were 300 people in the room. I think it was the NAA conference in Philadelphia. And she says, why are you in here again? I said, because I learn something new every time, Dr. O'Hara, which is true. So she's a great source of information, and I definitely buy her book. It's so helpful. All right, I'm going to stop sharing.
Okay. And I unmuted myself. So, now I get to look at myself. Sorry, guys. And by the way, in addition to the hardcover and Kindle or whatever it's called, I do have an audio book, and the audio book is the same book, but it has 5 new chapters, and they're on COVID, Bartonella, Babesia, mold, and cerebral folate deficiency that aren't in the paper book. So, I want to go through the questions, hopefully as fast as I can. I am willing to share my slides, and I did send them. And again, I'm happy to send them again if the people at NAA or ASPIRE want to share them to you. So share them with you. First question was about Bartonella. How do I treat it? As I said, I treat it herbally. There are a lot of good herbal companies. I personally use a lot of Nutrimedics, but Beyond Balance is excellent. Limecore is excellent. There are many. You need to pick one with your practitioner that you feel comfortable with. I do dose it as per Clark's rule, which is the adult dose. The child's weight in pounds divided by 150 times the adult dose. So if the adult dose is 30 drops, and the child weighs 75 pounds, somehow the text came right up there. I didn't do that. I don't know thank you. If the child weighs 75 pounds, then that's 15 drops. The dosing really should be 3 to 4 times a day, but in kids, we can never do it more than twice a day. So I often double up that dose, but I will start with literally 1 drop because some of these kids will hurt or have a die-off reaction. And I want to avoid that and go slowly and build up slowly. Some of the best herbs are Japanese knotweed, cryptolepis, Chinese skullclap, hatunia, campsiandra, and then certainly stevia, as I said during the talk. The next question was about any research on adults with ASD and PANS. There really isn't any research yet, but as Gabriella said, they have a great group for adults. And all the, in my opinion, as a pediatrician, I don't really like adults. I tolerate you guys, but the treatment is exactly the same. So everything I said, every testing I talked about is the same for adults. Um, uh, um, your serum sickness, there can be a relation. A lot of those kids may have mold or tick-borne disease in the background. And that's something that is really important. It is a different illness, but it can be related because of the underlying triggers. COVID antibodies, I have had lots of success in treating it antivirally with things like the monolaurin or aqualaurin, as I mentioned, and that's aqualaurin.com. I have also used the antivirals that I mentioned. Then you also have to use something to help break up the biofilm, the microclotting. Something like an enzyme like lumbrokinase, nattokinase can be very helpful. Sometimes using NAC can be very helpful. If it's brain fog, some things that we use in Alzheimer's like memantine, leucovorin can be helpful. And there are multiple others. So it really depends on the individual child, but that's just some guides. When a child has numerous things like mold and vector-borne diseases and chemicals, everybody always asks me this, what order? I'm looking at the child in front of me and looking at what's going on with that child. If the child has yeast on exam and has a bloated belly, I'm going to work on the gut first. If a child has really high levels or a very high questionnaire for tick-borne disease, I may work on that first. But truly, if I'm using herbals, I may be working on everything. You know, aloe binds mold mycotoxins and treats the inflammation. Modified citrus pectin is a food-based binder, but it also decreases the inflammation from tick-borne disease and increases good or commensal flora. The herbs may treat the yeast, the mold, the tick-borne disease, the strep, and everything else. And we've got to detoxify everybody. But detoxification naturally, getting outside in the dirt, sleeping, eating well, exercising, breathing are the best forms, and pooping every day are the best forms of natural detoxification. It can make sense to treat the nutrition deficiencies, the inflammation, infections, restore the gut. Absolutely. All that is necessary and all that may need to come before the further treatment with antimicrobials, but it depends on the individual child. The questionnaire for vector-borne diseases, it's Dr. Horowitz. You can just Google it. If Gabriella or Crystal, you don't have access to it, just email me and I'll send it to share with everybody. The same with Jill Krista's questionnaire. Where and how do you recommend testing for cerebral folate deficiency? The only test is the FRAT test, the folate receptor antibody test from Iliad. It's fratnow.com to find out more information. But as I said, you're playing the percentages to just try leucovorin. Or high dose folinic acid and I've lectured on this many times, happy to do it again. But there are many genomic SNPs, single nucleotide polymorphisms, not just MTHFR, many. And other reasons that children with autism or PANS PANDAS or tick-borne disease or all of it may have cerebral folate deficiency. So it's also very safe to start low and build up very slowly up to 1 to 2 milligrams per kilogram. Dairy, all dairy products block the same folate receptors at the blood-brain barrier. So if you have cerebral folate deficiency, you do need to be dairy-free for it to work well. Let's see what else. So much information. Yes, it's being recorded. Yes, you can watch it 10 times over. Classic presentation of anorexia for 3 years, recently realizing that pandas may be underneath it. The thing with classic eating disorders is that often with PANS pandas, they have much more of an OCD flair, a fear of contamination, a fear of vomiting, a fear of something getting stuck. But I have seen it with much more classic anorexia. And you want to start looking, do they have vector-borne disease? Do they have mold? Those are all things you can do just with a questionnaire or the regular lab blood test that I was showing. Do I suggest removal of tonsils in pandas? It's a 50-50 proposition because the tonsils and adenoids are part of what helps our immune system. So if a child have other reasons to remove the tonsils, recurrent strep infections, sleep apnea, cryptic large tonsils, then yes. If not, I do have a couple of ENTs, one at Yale, Dr. Karras, who are very good at looking at the tonsils and the adenoids and helping decide whether it's worthwhile or not. If they don't have any obvious physical symptoms, how do I know if my child is healing? Well, if you're on this call, your child must have PANS. And if they have Babesia and the PANS is not better, Babesia can take years to treat. So I would be using the herbs to treat it and retest after a year to see if we've done enough. Again, Cryptolepis is one of my favorites, but there are many others like Artemisia, Alcornia, Chinese skullcap, Cordyceps, Hatunia, others. There are links and they're all over Aspire to all of this. Are dried herbs just as effective as tinctures? I don't use them. I find the tinctures to be very effective. The other group is Herbal Vitality. Herbal Vitality and Beyond Balance are glycerin based. Limecore Nutrimetics are alcohol based. There's a lot of difference of opinion as to which is better. I know that the alcohol is the same in a whole tincture bottle, the same as what's in one ripe banana. So it's a very small amount of alcohol and it does increase absorption into the cell. I did already show in the talk about why I think there's so much misdiagnosis, mistreatments. So I think I already answered that. Somebody said they love cromolyn. Me too, as I told you. How do I get the kids to take all the supplements? I think one is, first, if your child is cognizant enough to understand, not lying to them, not hiding it, but putting it in a small amount of something that tastes good. A little bit of a smoothie, pomegranate juice, dark cherry juice. And if you have to, I don't care if it's cocoa powder, chocolate, whatever. Ice cream, dairy free. But something that gets it in. And then follow that up with something that doesn't have it in as a reward. Bribery is a great form of parenting, in my opinion. I'm not taking new patients. I'm getting old, but I am mentoring, and I showed you all the ways that I can be helpful. And there are a lot of great docs in Connecticut alone. Dr. Wells, Dr. Hinchy, Summer Del Signore, who's a nurse practitioner, Dr. Johnston, who's a DO, Dr. Moorcroft, who's a DO. There are many, and that's in Connecticut alone. There are a lot of others, and I'm sure Gabriella and those at NAA can help you find a good practitioner. higher doses of herbs can often cause mast cell activation. If you're having reactivity side effects with higher doses, then you need to decrease the dose and start with lower doses. I always start lower and increase slowly. I don't recommend amoxicillin. I told you in the talk, azithromycin and cefdinir are my two first line when I do use antibiotics. If it's mycoplasma, tick-borne disease, then minocycline or doxycycline I may use also. I already talked about the COVID antibodies. SOT. SOT is selective oligonucleotide therapy. It's an IV therapy that works on the gene replication of the tick-borne disease or chronic virus. I don't do it in my own practice, but I have a lot of practitioners that do very successfully. I think it's a great intervention. Dr. Casey Kelly, who's in Chicago, does it in her practice. Dr. Frid in New York. There are many that do it. Basically, you have to have a positive test for Bartonella in a very specific form, or for Babesia, Borrelia. There is also chronic viruses like EBV, CMV. You have to have a positive test for it. They send it off to a lab in Europe where the specific SOT, which is an IV treatment, is made, and you do that for whatever tick-borne disease or virus you have. Elevated CAM kinase, that's just a marker. Again, it doesn't mean that there are sensory issues. The sensory issues are because of the inflammation in the brain. Your child can have sensory issues from the brain inflammation, and the CAM kinase be normal. Okay. Let's see. I'm just looking to see if there are any others. Can IVIG cause OCD to become worse? When they're worse with IVIG, I usually find that mold or vector-borne diseases are not fully treated. And in fact, the immunologist that I work with, Dr. Babulis, will not start IVIG until the effective treatment for tick-borne disease, either antibiotics or herbals, is started. And in my opinion, that should include mold also. Foot peeling, if it's the glue-like peel, that can be indicative of PANDAS or strep. If it's the wet peel, that often is yeast or mold. OCD behaviors for 12 years. Absolutely. I have, I have a really long waiting list. And again, I'm not taking new patients now, but I've had kids that have had it for years and have gotten better. Ehrlichiosis does not cause your CAM kinase to be elevated. Your CAM kinase elevation is from strep. It can be other inflammation, and ehrlichiosis can cause it. I see that more in adults than in kids. Ionic foot baths can be helpful. It's a nice adjunct. It's not the be all end all, but they can be helpful. Continued nasal ticks. There's science colonization. I often will use xylitol or something like Argentin, which is colloidal silver, or a bag eye spray that's bacitracin, EDTA, gentamicin, and itraconazole, but that's a prescription. If we have, I already talked about what to treat. You got to treat them all. And that's why I use herbals a lot. Let's see. Can you talk about migraines and chronic fatigue? I really, we're already at 7:53. I'm glad to give another talk on that. They can be symptoms that we see, especially with mold, COVID, and tick-borne disease, but they can be with anything. Let's see. Mental health diagnosis. I'm going to say something that I believe to be true, as do all the people I train and teach with at Psychiatry Redefined and MAPS. All mental health illness is at least partly, if not fully, brain inflammation. And treating the inflammation can help, whether it's actually PANS PANDAS or some other type of autoimmune encephalitis, it can help. And I think more and more, even in our conventional community, we're seeing that. So I treat as if it's autoimmune encephalitis in everybody. Rosalie Greenberg, who's an excellent doctor in New Jersey, 75 to 80% of her patients with mental illness have tick-borne disease in the past. Brian Fallon did a study of millions of people showing the same thing at a study in Denmark. The Picardin is very protective. Those are Sawyer products against ticks. You can wash your clothes in it, soak your clothes in it, and then let them dry. That can be very helpful. A bandana around the neck, a baseball cap, socks, even shoes. And you can use it in sprays or lotions. That's what I use. There are effective herbals, as I mentioned at the beginning, things like ashwagandha, rhodiola for rage and anxiety. Tick tests, I use tickreport.com, the complete panel. The stretch marks, if they're linear, like horizontal, vertical, not following dermal lines, and if they blanch, that's Bartonella till proven otherwise. Why does Babesia come up positive? Because you have Babesia. I mean, that if Babesia is positive, you have Babesia. And that needs to be treated. As I said, lots of herbals. DNA Connections Lyme is not a validated study, and I'm going to tell you, neither is Vibrant. And if they're not validated, I'm not going to use them. So Igenex is the gold standard. I talked about MDL. Galaxy is great for Bartonella, as is MDL. And MDL is covered by insurance. There are others like T Labs, Armin Labs, Red Labs that do have external validation studies. I use doctor's data mainly, or Mosaic, which is doctor data for my gut stool tests. And True Dose has been very effective. This person was saying 95% better. I do find that very effective. If you have a lot of debris, if somebody's telling you that, that child may not be detoxifying well, or may have very high COVID antibodies, and I would look for that. There may be other things, but those are two off the top of my head. At what rate of time and amount? I increase by 1 drop per day. I go very slowly. And that's the way I do it. You can do it just on the weekend by like 5 drops, but so let's see. Myasthenia gravis, it is separate from Lyme. But a lot of these diseases that we talk about can have tick-borne disease in the background. You don't catch PANS. PANS is an autoimmune disorder. And if you have an abrupt onset of symptoms, then you may well have PANS or PANDAS. You've got to look at the whole history, physical exam, and find a practitioner that is knowledgeable that can work with you. So that's all the questions. We're right at 8:00, which is what I promised we would be. And I want to again thank everybody at NAA and ASPIRE for inviting me to do this, and for all the great work both of those organizations are doing. So thanks, everybody.